Tay-Sachs.
Tay-Sachs disease is a rare disorder that progressively destroys nerve cells in the brain and spinal cord. A defective gene on chromosome 15 causes Tay-Sachs. The defective gene on chromosome 15 causes the body to not produce hexosaminidase A, which is a protein essential for the body. Without this protein, gangliosides build up in the brain, destroying brain cells.
What are the chances? Tay-Sachs is a hereditary disease, so both parents have to be carriers for their child to receive it. When both parents are carriers of Tay-Sachs, there is a 1 in 4 chance their child will be diagnosed with Tay-Sachs. Although Tay-Sachs carriers are found most common among families of Eastern European Jewish descent, this disorder affects people from all over the globe. 1 out of 250 people of all races have this disease. 1 in every 30 people of the Ashkenazi Jewish descent is carriers for the Tay-Sachs. In the United States, about 16 citizens are diagnosed with Tay-Sachs each year.
Inheritance pattern. This condition is inherited in an autosomal recessive pattern, meaning both copies of the genes in each cell have mutations. Also saying a child can only be diagnosed with Tay-Sachs if both of their parents are carriers.
What causes Tay-Sachs? Tay-Sachs disease is caused by a genetic mutation in the hexa gene. This mutation affects the production of an enzyme called hexosaminidase A. The hexa A plays a major role in removing a fatty substance called ganglioside. Without the enzyme, the ganglioside will build up inside the nerve cell, causing them to slowly lose all their functions. In most cases of Tay-Sachs disease, the enzyme is completely absent. However, in some cases there may be a limited amount of the enzyme, causing the ganglioside to slow down the rate at which they are damaging the nerve cells. A single point mutation is all that is needed to cause Tay-Sachs.
Signs and symptoms of Tay-Sachs may include muscle weakness, problems with coordination, feeling faint, difficulty swallowing, hearing loss, seizures, vision loss, impaired voice, and loss of muscle function.
Tests used to check for Tay-Sachs. Tay-Sachs disease is diagnosed through a simple blood test that tests the hexa A levels in the blood. A person can also find out if they have Tay-Sachs through a DNA test. Children born with Tay-Sachs are usually diagnosed by a characteristic red dot found on the retina of the eye. This dot does not often show for people diagnosed with Tay-Sachs during their teen years or during their adulthood.
Treatments. Unfortunately, there is no cure for Tay-Sachs, but there is medicine that is used to reduce symptoms and seizure medication you can take.
Prognosis. Children who are diagnosed with Tay-Sachs when they are born don't get symptoms till they are 3 to 6 months old, and usually live no longer than 5 years old. The reason children die at such an early age is because of fatty waste substances accumulating abnormally in the body and causing progressive damage until the nervous system gives out. Tay-Sachs can also occur in teens and adults. Although this occurs less often while occurring in adulthood, Tay-Sachs is less severe than being diagnosed as an infant. The severity of symptoms and life expectancy varies for Tay-Sachs in adulthood.
Sources. Thanks for watching.